So when I was in graduate school, I actually did my graduate degree here at LSU. I was planning on pursuing a career in just imaging, and imaging is pretty hospital-wide. It's not just specific to cancer care. But while I was in graduate school, my mom had breast cancer, and that really made me want to be able to communicate a lot more of the cancer therapy side to her, because she doesn't come from a scientific background, and be able to use my expertise to help cancer move forward. Radiation therapy can be misunderstood by the public. I think radiation can be a very scary word for a lot of people, and they automatically think of things like Chernobyl and nuclear bombs. But here at Mary Perkins, what we're trying to do is use radiation in a way that is helpful to people. And one of the best ways to do that is to treat cancer with it. We know that we can eradicate tumors with radiation therapy, and so we are using it in a way that will heal people and not in a way that's going to hurt. And so one of the ways that we explain this to patients is that it's not like all radiation is just automatically bad. If you apply it in a way that we're treating the tumor, we're minimizing the dose to healthy tissues, we're minimizing the patient's risk, but we're also making sure to get rid of the tumor. And those are the two main things that we're looking to do in adaptive therapy. It's really hard to pick out one single patient case, because we see so many patients that come through this door where their lives are just completely changed by the treatment from the adaptive therapy machine. With conventional therapy, a lot of the times you have to come back in for 20 or 30 fractions, and that's 20 or 30 visits for a lot of these patients. But with adaptive therapy, we're able to take that down to maybe just 3 to 5 visits, and every patient that comes through those doors can appreciate that. So MR safety is a huge part of the MR-Linac adaptive radiotherapy platform. You not only have to worry about the radiation and making sure that that's safe, but MRI is an entire other ballgame altogether. You have to worry about implanted devices. If patients come in and they have something like a cardiac stent, if they have orthopedic implants, pacemakers, spinal cord stimulators, there's a lot of implants, and we can scan most of them safely on the Unity. You may have to make some changes to the protocols. You may need to communicate with the therapist, like instead of using the default Unity MRI pulse sequences, you may have to make a few changes. But ultimately, as long as you have a good team that's vigilant about screening your patients and making sure you know what's there, then you can treat most patients effectively using it.